police!
Urgent assistance.
In modern Britain,
There's been a big accident.
the most dramatic 999 calls
The car is now on fire.
often require not one, but two emergency responders.
I'm a police officer, she's a paramedic.
In Kent, one of Britain's biggest counties,
I'm just thinking if we just cover it all.
a groundbreaking joint response unit has been formed,
Ready, set, lift.
where both police and paramedic combine in one specialist vehicle
You've been arrested for assault.
to answer some of the most extreme 999 calls.
Right, stand clear. Everyone clear? Shock.
We already outdone ourselves on that one.
Face the wall.
Mate, I can't believe we got him.
Coming up, a shooting terrorizes a sleepy village.
They have got guns pointed, so do exactly as you're told.
A country walk ends in agony.
1, 2, 3.
And a very lucky escape.
If he'd gone head on into that lamppost, then we'll be dealing with a fatal.
Rural Kent, with its picturesque villages, isn't without its dangers.
Where's the emergency?
Anyone close enough to assist, please contact control, over.
So when someone calls 999,
I am short of patrols. I will see if I can get someone to attend, over.
the joint response units must be ready for anything.
This poor guy's been laying on the floor for so long, and it's very much appreciated.
Juliet Romeo 07 Patrol.
Juliet Romeo 07, go ahead.
CCAM have just had that come through. Would you like us to start making way to that?
There have been reports of a shooting in a small village in the Kent countryside, and a JRU team has been requested for medical support.
Yeah, that's obviously effective, but obviously stand by for FIM assessment.
What's a fin?
FIM, Force Incident Manager. So they are an inspector based at Force Control Room who will look at incidents and assess them to see what sort of response is required. For example, something like this, where firearms will be involved.
Kent Police Special Inspector Tom and Joint Response Paramedic Willow from the South East Coast Ambulance Service have been asked to meet at a rendezvous point with armed officers.
We got it initially as patient's got a leg injury, so something was thrown at him to injure his leg, but has now reported that actually thinks they've been shot.
So for us, in terms of the police involvement, it's because there's a firearm involved. If someone's got a gunshot wound, and if that's hit an artery, that's potentially going to be fatal for them and could even turn into a murder.
So Foxtrot 4 are 1 minute from the RVP.
The priority is for a firearms team to go in and make the scene safe.
Once the threat's been neutralised, units such as myself and CCAM will be called in to deal with casualties, to deal with arrests and that sort of thing. The priority for us is to keep our distance until we're given the green light to go in, because the last thing we want to do is get shot.
The first concern is to avoid further danger to the public and to themselves.
Sometimes it can be quite brutal and it can be quite difficult because you've got a patient that's potentially dying. But if I can't get them alive, I can't treat them.
There's no other information on them.
That's all right, I found it.
How far are we from our RV?
4 minutes.
The rendezvous point is just a few miles from the scene of the shooting.
I think we're meeting here. I think we're just meeting here. It's that RVP point.
I'd say the firearms are already here.
Gun crime in the UK is rare, and this is a first for paramedic Willow.
But actually in Kent, especially, like, we don't see a lot of gun crime at all, do we?
I mean, I've been in Kent Police 11 and a half years now, and I've been to a total of 2 firearms incidents, this being the second.
Shootings and stabbings are far lower in rural areas than the big cities, but Kent Police, like every other force, have a firearms team who's always ready to deploy.
So we've got a rest team going, and they're going to be going, but they're going to be kind of hanging back a little bit.
Cool.
So, yeah.
So it's getting them neutralised. Have we got to confirm whether there's a firearms licence on the premises or not?
I don't think there is.
If we follow up behind us, once they've neutralised, we can then deal with casualty, and then we can bring the van in if need be.
What's happening, just so I can let them know?
Sorry?
What's happening now?
So they're going in first. We will follow in as medical.
With the firearms team already in place, the JRU has the green light to move in behind them.
Who do we need? Is it life-threatening? Is it safe? Essentially, is the first thing that they're looking at. Jobs like this kind of escalate very, very quickly, and as soon as you mention the word gun, nobody can risk it, so we'll take it very, very seriously. So, hence why you have, a massive presence from all different sorts of managers and resources.
The shooting has reportedly taken place outside one of the houses on the estate. The suspect is thought to be hiding somewhere inside.
So the 2 unmarked cars are the police cars, and the car with the blue lights going is the dog unit.
Because Firearms haven't given us the okay to go and the scene is safe, we're having to wait currently, so.
Of course, if shots are fired, then we will need to move in imminently to save life and limb. They will see Cam.
The JRU team get the call to move to the front line.
I've never seen that before, so Firearms in balaclavas.
Tactical firearms officers have taken up position.
I'd just be warned that they have got guns pointed, so do exactly as you're told.
With eyes on the suspect. Shooting incidents are fortunately rare.
Can anyone respond to a C1 emergency?
That's a C1.
Unlike the 30,000 cardiac arrests which happen outside of hospital every year.
Broadcast, any patrol able to assist with a C1, got cardiac arrest in a public place, your call sign, over.
Special Sergeant Jack and paramedic Nathan are going to a Cat 1 call, which indicates immediate threat to life.
So we're going to a train station for a cardiac arrest?
A cardiac arrest is when the heart stops beating, blood stops flowing to the organs, and the person stops breathing.
03. Yeah, I'm not going to be able to give you a scene update as soon as I get there. We're going to be first on scene and we'll jump on CPR. So as soon as I can give you an update, I will.
Without help to start their heart, they will die. It's different to a heart attack, which is when the arteries supplying the heart are blocked.
Platform what? Which platform? Which platform? Which one? This one down there.
But a heart attack can lead to cardiac arrest. The call came in just minutes ago. The man on the floor has no pulse. The team need to move fast. Nathan prepares the defibrillator to try and shock his heart back to life.
You want to get the pads out, mate?
Pads on?
Yeah.
Yeah, cheers, mate.
But it takes time to set up. And in the fight for life, every second counts.
Oh, mate, where are the pads?
Just setting up.
The man is stuck under the seats, and the team needs space to start CPR while they wait for the defibrillator to charge.
There you go.
Not waiting for the pads, paramedic Alex starts immediate chest compressions to try and restart his heart.
Just chuck the whole thing.
Alex, need anything else?
Just update control, mate.
CCP running, yeah?
Yeah, probably, mate.
Yeah, we'll update it, mate. I'll jump on the chest.
Right.
The defibrillator is fired up.
Everybody clear, shocking.
Take over, Alex.
Take that for us.
Right, stand clear. Everyone clear?
Yeah.
Shocked.
At Chatham railway station, a man has gone into cardiac arrest, and paramedics have used a defibrillator to try and kick-start his heart.
Can we get a size 5i gel as well?
Everybody clear, shocking.
I got a pulse. Yeah, I've got a pulse. He's breathing.
Tell Darren to get that trolley and stuff ready.
Yeah, yeah. Oh, Darren, get a trolley and a scoop ready, mate.
Trolley and a scoop.
Cheers, mate.
It seems to have worked.
Got a good end tidal. We've got rest of 15 at the moment.
The patient's heart is beating again, but he's still in a critical condition.
He's making good respiratory effort. So, pupils are freeze.
In order to give life-saving drugs as quickly as possible, Nathan's colleague Alex drills into the patient's shin, so drugs will go straight into his bone marrow.
So we've had, what, 2 shocks, was it, or 3 in the end?
2 shocks.
2 shocks.
See what his blood pressure is.
We're doing that at the moment.
Yeah. Does he have a radial?
He's got a very strong pounding centre.
I think this whole lot of fluids then.
His heart is gaining strength.
Can we just mind grabbing that off?
We need to push the trolley up further. Move the lights back to place.
While the paramedics work on keeping the patient alive, Jack has been busy looking for contacts of loved ones.
I found a wallet, but it's got no driving licence in it, so he's got no date of birth. But I found a letter that's got his home address. So they're going to get some officers there, firstly, to tell next of kin, secondly, so they can get down the hospital, and thirdly, so we can find out any details about them that we need.
When patients are in cardiac arrest, they're not breathing, their heart is not beating. For all intents and purposes, they are dead in that moment.
He's not out of danger. The crew need to get him to hospital urgently.
His heart could stop at any time. It's still a really critical position to be in.
The Kent coastline and countryside is a dog walker's paradise. But sometimes a day out with the pooch doesn't end up as planned.
Got an address, it's actually in a field, I believe, from a cattle grid. A member of the public's got their foot stuck.
Special Inspector Scott and Joint Response Paramedic Aisha are on their way to help someone who's been injured while walking his pet.
Is it a male or a female? A male. She's fallen over. And he's got his arm stuck.
Oh, his arm stuck?
Yeah, fractured arm.
I don't know if he's got anything stuck. I think they're just saying that there's a cattle grid on the way out.
Right, so he's not got stuck in the grid?
No, I don't think he's got stuck in it. I think he's just fallen and fractured his arm.
So essentially we're on our way to a male that's fallen over in a field, potentially he's got a fractured arm. Unknown sort of level of injury at the moment. He may have obviously obtained other injuries, but say when we get there we'll assess the situation and we'll go from there.
He's out in the elements at the moment. It's kind of raining on and off. The call came in 45 minutes ago. So any patient that's getting cold, that's going to make them deteriorate even quicker.
In a village in rural Kent, a woman has been shot. As they wait for the suspect to come out, the firearms officers are standing by.
I've just been warned that they have got guns pointed, so do exactly as you're told.
Suddenly, reports come in that the victim who's been shot is being brought out. And the police are asking for a medic.
Right, so keep your distance.
JRU paramedic Willow has been called in to help the victim.
Shot I?
Willow, hello.
Unfortunately, he's just taken a couple of shots to her leg today.
Okay.
So I put the field dressing on, that's stemming and bleeding. Obviously, it has been bleeding.
Okay.
She's been fine. She's a little bit upset, but she's been fine.
Any other patients?
Not this time.
No, okay. Just come have a seat over here for a minute.
While Willow assesses the injury,
Have a seat there for me, okay?
a manhunt is underway.
Can you describe the person who shot you in the best detail you can? What does he look like? Is he a bit tall, short?
I just felt a pain in my leg and I looked down, so I can't say.
Yep.
No, so we're trying to get a description of the offender, but she can't really remember too much. That's as good as it gets, unfortunately. So we believe we've got an active shooter in the address, given the fact that the lady's got a shot to her leg. The firearms are trying to encourage the guy to come out. If you look up there, they're utilising the drone to try and keep an eye on what's going on, see if they can get a better vantage point. If there is potentially a firearm involved, the last thing you want to do is put an officer in harm's way, whereas the drone is out of the way and you can see everything, and you can wait as long as need be for him to come out.
Can I have a quick look onto here, if that's okay?
Willow inspects 2 wounds on either side of the woman's leg.
I don't do your bloody operations, all right?
Well, it would depend. If the bullets come out, no.
It appears the bullet has passed clean through the leg and crucially missed any bones.
So it's going to be hospital.
I'm going to a panic attack.
How are you going to get upset? Don't panic. Listen, you're absolutely fine, okay?
I know, with my teeth shattered, I'm going to go.
Yeah, well, don't have a panic attack. We're all here, aren't we? You've got me, you've got the police. All right, you're absolutely fine. I think she's still got a lot of adrenaline going through her body, so she had a bit of a panic attack in the car. Just try and relax, okay? All right. I know there's a lot that's happened. It's all quite a massive shock, isn't it? Okay. But your leg can be fixed. Just an update for you on this job if you want one over. So the lady does appear to have 2 puncture wounds just below the knee on her left leg. There's no active bleeding and no critical hemorrhage at all over. So she's absolutely fine. It looks as if a bullet has gone in just beside her knee and come out on the other side. I think she's been incredibly lucky in terms of where the gun has hit her.
She is lucky, but the fact the bullet went clean through shows how dangerous it might have been.
It's not been identified what she was shot with. I'd imagine by the wound that's going to be a very light caliber weapon. But yeah, for now it's just a waiting game.
Suddenly, more than an hour after the shooting, the standoff appears to come to an end.
Is anyone able to go forward to the OSD by the red vehicle there? There's a prisoner off.
Is he surrendered, has he?
He's come out there for arresting somebody. So
okay, right.
It's going to need taken away from where they are.
The man they believe fired the shot emerges from the building.
The good news is one male's come out without further incident. He's been arrested for various offences. He will be taken off to custody and interviewed in the morning.
The injured woman is on her way to hospital.
You shouldn't hate anybody in this world. But do I hate someone that done this to me tonight? Because yes, I do. Because that is cruel, that is evil, that's nasty whoever done this to me.
Fortunately, she's not in any danger, but only because the bullet didn't hit any vital organs or arteries.
The injury, to look at it at face value, you think she's got a couple of scratches, or like a small puncture wound. You wouldn't necessarily associate that with a gun. Gunshot wounds, it comes down to luck really in terms of where they hit you. If they hit you in the wrong place, within minutes, seconds, you could be dead.
Right, Skipper, are you happy for us as JRU to stand down and... Okay, right, thank you. For now, it's just a case of searching the house for any potential evidence, and we've left the local policing team to get on with that. So for us, it's back on patrol.
In Chatham, JRU paramedics have managed to restart the heart of a patient who had gone into cardiac arrest, but they urgently need to get him to the intensive care unit.
They're just discussing HEMS, whether HEMS come to assist and take him somewhere. As I say, it'll either be Medway or William Harvey given the traffic. That's why they're looking at HEMS so far.
HEMS, the helicopter emergency medical service, is on standby as the patient may need to be put into a coma to prevent brain damage.
Can we plumb into the main oxygen? We're not at the moment, but we can do.
So let's plumb into the main.
It's down there.
We're not trying to stop someone from dying, we're literally trying to bring someone back from the dead. And that's what we've done for this patient. He was dead and we brought him back. We have got the helicopter coming, HEMS, because they can provide a kind of higher level of care. Time is absolutely of the essence at the moment.
1 hour after 999 was called, the patient is taken to hospital with a HEMS helicopter trauma team in attendance.
They've sedated him. They're now going to take him up to the nearest suitable hospital. Definitely not out of the water yet for him. He's obviously had a lot more trauma to his body with the CPR, with the other query heart attack as well. Not sure if there's anything else that's going on. So he's still very much a time-critical patient and needs definitive care.
A man who's been walking his dog has fallen and broken his arm. The incident has happened in a field on the fairly uninhabited Hoo Peninsula, 9 miles from Rochester.
How do we get in?
Luckily, the JRU vehicles are 4x4s that are designed to handle off-road call-outs. They can get to places standard ambulances cannot.
First time off-roading in these. I got stuck in a field in an ambulance once. I had to have a load of people trying to push us out.
Oh, really?
It was really wet. It was in the middle of bloody winter.
A team of paramedics trained to operate in hazardous environments has arrived just before them.
Hello, you all right? Not too bad.
This is Dave.
Yeah, lovely.
Dave has humerus fracture.
Humerus fracture, yeah. You've got a broken humerus, the bone in the upper arm, quite a big, thick bone.
Do a few checks, get some drugs on.
Absolutely. Do you want me to try and cannulate for you?
Yeah.
Fractures of the humerus can be incredibly painful. Even just breathing can hurt. So Aisha's first priority is to give Dave intravenous pain relief before she moves him.
Bad arm's the left one.
Left one, I'll go for the right then. Right. Oh, bless you, darling.
Dave's arm muscles have reacted to the break in the bone by going into spasm.
Let me just get to this arm, sweetheart. I need to try and get a cannula in.
Dogs.
Oh, bloody dogs.
Oh, God.
Should we get some gas and air?
Gas and air is a mix of oxygen and nitrous oxide and works as a short-acting painkiller.
Very good, good drug. You've got to make sure you haven't been deep sea diving recently?
No.
No.
I apologise now if I swear.
Don't worry, you swear as much as you want.
Aisha wants to give Dave stronger intravenous pain relief. But Dave has been lying outside in the cold for over an hour, making it difficult for Aisha to get a needle into his veins.
Sorry, darling. Gonna have to go again with that one. I need some tape.
Yeah, do you want red one, isn't it?
Yeah, please.
When a first attempt to cannulate fails, the patient can tense up, making the next one even more difficult.
Relax your hand. Your fingers are tense. There we go. I know it's not easy. I'm stabbing you. Got that tape still?
Yep.
Brilliant, thank you. All right, go third time lucky.
The second attempt fails, and with the temperature dropping, unless they get him moved soon, his condition will become critical.
Female. I'm not sure if you heard you called them.
Lovely, thank you very much.
In northwest Kent, Joint Response Paramedic Nathan and Special Sergeant Jack are responding to an emergency call from a lifeline company, a service for frail and disabled people when they need emergency help at home.
It's going to be these here, isn't it? It's 86 as we just arrived.
The only information the team has is that the woman inside is an epileptic and her seizure detector has gone off.
We are going to a fitting.
There's no answer.
Hello, ambulance.
Nathan needs to get in to check the woman's condition because a prolonged seizure can sometimes be fatal.
Key safe.
Fortunately, the emergency services have been given the key safe code for just such an emergency.
And it's from a lane. Callback 1, answered, can hear patient making noises but not responding.
Hello, ambulance.
Now they just need to find a lane.
Anyone there? No.
Hello.
Oh, cats.
Sorry, little cats. Hello, my love. It's the ambulance service.
They find her, but she's not responding.
Hello, my love. Hello.
15 miles away on the Hoo Peninsula, Dave has fallen and broken his arm while walking his dog.
So what happened? Did he just pull your or?
Yeah, he's a bit of a nightmare.
Yeah.
So he's run round the back of me, so
Yeah.
he's pulled my arm up my back. But he'd also run round my leg as well, so when I tried to step out of the leash,
Then you've landed on your arm.
I've landed, fallen backwards, but my arm was underneath my body.
Oh, not good.
And I knew straight away.
JRU paramedic Aisha is trying to inject painkillers, but has been unable to find a vein. And Dave's temperature is dropping, making the procedure even trickier.
Really good veins.
You've been out in the cold.
A third attempt is made, this time into Dave's ankle.
Is that Entonox helping, Dave?
To everyone's relief, the needle has gone into a vein, so Aisha can attach a cannula.
All right, so that's some paracetamol in. That'll start working really quickly.
Dave is immediately given pain relief, but paracetamol isn't strong enough to deal with the pain Aisha knows is to come.
Have you ever had morphine? No? So very, very good pain relief. Makes you feel like you've had 1 or 2 gins, maybe a few more. We had to make sure we get some pain relief on board. I think he hasn't had morphine before. I'll go 3 mils to begin with, see how we go. So that we can then splint that arm, pull it, get some traction on it, get those bones back in a more neutral position so that we can relieve some of his pain. Going to give you an anti-sickness and some of the really good stuff, all right?
Morphine can make a patient feel sick and dizzy, but it's essential as Aisha wants to realign his broken arm while he's lying on the ground.
Right, those drugs are in.
No, it will do, love. Don't worry.
Something's not right, like on what?
What doesn't seem right?
Any of it.
No, you're doing well. You're doing all right. It's just where the drugs are all going through the body. Okay? You've never had morphine before.
Okay. It's all right, darling. You'll start to feel a bit more with it in a moment.
Dave's wife, Deb, is on hand to help relax him as the painkillers get to work.
So waiting for pain relief to kick in so that we can get on with putting traction on that bone, because without the pain relief it would be absolutely excruciating.
Dave, get you up off the floor very soon, all right? Yeah. And get you straight onto that bed, all right, buddy, to get you nice and warm.
Another dose of morphine is needed.
She's doing really well. So, yeah, quite a tricky one. Don't you swear as much as you want. Nothing we haven't heard before.
Dave's now had 7 milligrams of morphine. The maximum paramedics can give is 20 milligrams.
So, yeah, we're going to give it a bit of a tug and then put a bit of pressure on it.
Enough about sex offers, but what about the arm?
With the morphine kicking in, it's time to attempt the realignment.
So we go on 3. 1, 2, 3.
You feel that pulling?
Yeah. Need a bit more?
The broken bone is pulled apart against his spasming muscles, which are trying to hold the bones in place.
Nearly there, Dave.
The bones are back in alignment.
Well done, love.
And Dave can finally be helped to his feet.
Ready? 3, 1, 2, 3.
Well done.
Alright, get on that stretcher. It's alright, I've got you.
Yeah, no, I'm not. It's just a bit tender.
To say the least.
That's it, lift.
One is mine.
Thank you very much for this.
You are very welcome.
When they get to A&E, Dave will be x-rayed, and the bones may have to be reset again under anaesthetic. But at least he'll have a nice warm bed.
The only thing you've got to apologise for is for not doing it on a nice warm day.
Back in Gravesend, JRU paramedic Nathan is treating a 32-year-old woman who's had a seizure and is unresponsive.
You'll pop this in your finger, my love, all right?
While Nathan checks Elaine's oxygen levels, Special Sergeant Jack has been looking for clues to help.
Right, here we go. These are May's dates. Was not well, had a headache, been busy all day, no seizures. Been sick.
It's a seizure diary.
What day are we today? Sunday. In bad pain. No.
Diaries are kept by many epileptics to try and work out what triggers their seizures.
I'm going to do your blood sugar and your temperature, all right, my love? Hello? It's the ambulance service. You've had a seizure.
Suddenly, Elaine regains consciousness without medical intervention from Nathan, but he still needs to do more checks.
Just going to pop this in your ear a minute. I'm just going to do a small drop of blood from your finger, OK? It'll be a sharp scratch.
Some people with epilepsy have back-to-back seizures, so Nathan is checking Elaine's temperature, blood pressure, and blood sugar levels.
How many cats do you have? 2. We shut the door before we opened your door, all right? They're all fine. They're just in the other room. Have you been feeling unwell at all?
Got a kidney infection.
Oh, you got a kidney infection? Oh, yeah.
Infections that cause high temperatures can trigger a seizure.
How long's that been going on for? A week, oh, bless you. Do you find you normally have more seizures when you got the infections? Yeah. Oh, bless you. What's your normal plan after having a seizure? Do you go to hospital? Do you stay here?
I normally stay there.
Normally?
Unless I have more than 4 or 5.
Oh, OK, that's fine. No worries.
I am known to have back to back.
Yeah. Oh, okay. Oh, bless you. You've just had the one today?
As far as I'm aware.
As far as you're aware. Is there any way of checking? Does your machine tell you how many?
My lifeline normally goes off.
Yes, your lifeline's gone off today. That's why we've come out. It's a good little bit of kit you've got to call us. How do you feel now? Do you feel your normal self after a seizure? Yeah? That's... And that's normal for you after a... Yeah, all right. So all your numbers are OK. So what I'll do is I'll do a bit of paperwork, and once we finish the paperwork, if you're still feeling like you are now, we'll leave you here. If not, it'll be a little trip to hospital, all right?
Thankfully, Elaine's vital signs are normal.
Oh, shut up, phone.
Oh, that's mine, sorry. That's all right. Sorry.
Elaine's been coping with epilepsy since she was just 13.
I can't work because of my seizures. I used to do caring for a little elderly lady that lived next door in a wheelchair, and I couldn't do it anymore because seizures got in the way. I used to go to college. They got in the way. I really want to be a nurse, but that gets in the way. It is difficult. It's part of my life, though. I've adjusted to it.
What's the rabbit's name? Babe.
Elaine's pets, 2 cats and a rabbit, are company for her.
How old's your cat?
Don't like cats, don't touch them. I don't like looking at them, I don't own them. Draw the line. Cats is a big no from me. Dogs, love them. Sorry. I won't be horrible to them, I just don't like getting scratched.
And Jack's tolerance to cats has reached its limit.
Oh, mate, I need to get out of here, my nose.
Jack and Nathan are confident that Elaine is out of danger.
She's back to her normal self. We're happy to leave her here. It's safe for her to stay here, even though she lives on her own. She's got all the safety measures in place. Leave her with some worsening care advice of what to do going forwards. Take it steady and to call us back if any symptoms change. And failing that, if she has another seizure, her alarm will go off and we'll be notified anyway.
As night rolls in, the number of accidents on the road increase by 40%. Getting to a collision quickly can be the difference between life and death.
On the A2, Greater, right off, airbags, blood everywhere.
Oh, we'll go. When did this come in? Oh, it's literally just come in. Yeah, car.
A crash has just happened on a busy dual carriageway near Gravesend.
Control, Juliet Romeo 03.
Go ahead.
Do you want to show us running to that RTC?
Perfect, thank you.
Joint Response Paramedic Nathan and Special Sergeant John head there on blue lights.
All yours, obviously the crew on now, just let me know with them.
Will do, thank you very much. We're 5 minutes out.
So we are currently going to an RTC on the A2 by Gravesend. We haven't got too much info at the moment. Just there's amount of airbags being deployed, lots of blood everywhere, so it could be anything. So we'll go and make a quick assessment. Obviously, it's on the A2. It's a fast road, so we need other units to help slow traffic and make a safe working environment.
A car is facing the wrong way down the A2 and its back end has smashed into a lamppost.
Is the guy still in the car?
On the A2 dual carriageway near Gravesend, Joint Response officers are dealing with a high-speed crash.
Is the guy still in the car?
You've got blood coming from somewhere. Is it all right if I have a little look? You've got a nice little split on your forehead.
While Nathan checks the driver, John tries to work out why he crashed.
Quite a nasty crash. He's obviously lost control and spun around, and you can see from the damage to the lamppost and to his car that it was a reasonably high-speed accident. I think he's really lucky to walk away. Crashing into a lamppost, I don't think he's gone straight on. If he'd gone head on into that lamppost, then we'll be dealing with a completely different scene and probably a fatal.
And a closer inspection shows just how lucky the driver was.
Bank is really steep. All it would have taken is probably another half a metre and he would have tumbled down, rolled over and then probably become trapped.
Just assessed him at the moment. He's got a nice little head injury, so probably be conveyed to hospital.
Oh, no worries. I'll keep the money for you then. Thank you very much.
Were you wearing your seatbelt?
Yeah.
How fast did you...
No.
Just got to check. Did your airbags go off? No, that's fine. Has your stereo come out or anything? Yeah, it has. It's probably your stereo that's hit your head then. You any pain in your neck?
No pain in my neck.
No?
It's just a head in my hand.
I would suggest you go to hospital for that head injury.
Yeah.
I should have a quick look at your car a second, okay?
Yeah.
So check over the vehicle just to see kind of what the damage is to the inside the car to work out kind of what injuries he's likely to have. His stereo's come out, so it looks like that's whacked him in the face.
That's my life.
Was it just you in the car?
I was going to pub.
Oh, were you? Oh, no. Well, I think you'd be going off to hospital now.
Yeah, so he's very fortunate considering he's in a bit of an older car, doesn't have the same sort of safety equipment as modern cars do. For the medical side of things, have you had any drugs tonight? Do you ever take cocaine? No. No? No, that's fine. Any alcohol or anything?
I think I had a drink last night.
He's at the moment in the back of the ambulance, being assessed by the paramedics, and he'll be going to hospital once they do a clean of his wounds. We breathalyse before he goes as well to see if alcohol was a factor in the crash, and the officers here will follow up with see if there's any offences.
The breath test is negative, so there are no driving-related offences.
So just talking to the officers in the back of the ambulance, the male's been arrested for a domestic incident.
The driver will still be going to hospital, but with a police officer, and will be taken to custody once he's been treated.
So it looks like the male was either wanted or had breached his bail, but he's been arrested for criminal damage.
Kent is one of the largest counties in England, bordered by the English Channel to the south and London to the north. Tonight, JRU paramedic Daniel and Special Constable Tom are in Greenhithe, just 23 miles from central London.
Ourselves and the ambulance services had about 3 or 4 calls about a car crash, potentially a female patient with chest injuries, trapped because they can't open the doors.
An injured motorist trapped inside her car will need both a police and paramedic response, and the team is only 5 minutes away.
This is a prime example of quick patient care, but again sort of helps our divisional colleagues, our response officers, from picking that up.
As they arrive, it seems a car has hit a parked vehicle.
She's still in the car, is she?
Around the other side. Around the other side.
Hello, you're right.
The driver is unable to free herself.
No, it's all right. Just relax, okay? Tell me what's happened.
I don't know what happened.
What is the last thing you remember then?
I don't know.
It's fine, no worries. What do you suffer with? What medical conditions?
And I've got a thing in my heart here. It's a loop recorder because I was getting palpitations and a blackout.
Okay.
I haven't had nothing like that for a long time.
A loop recorder is a small heart monitor fitted under the skin to record the heart's rhythm.
Bang, I hit the steering wheel on this side. I'm in so much agony.
Fine. Was you wearing your seatbelt?
Yeah.
You know, that's good.
While Dan checks her over, Tom focuses on traffic management.
So at the moment, I'm just sort of like keeping the scene safe for Dan, just so he can crack on and get on with what he needs to do.
How are you feeling at the moment?
When I breathe, it hurts.
When you breathe, it hurts,
On
okay?
this side.
You're down that side, yeah?
I feel sick as well.
Yeah, if you're going to be vomit that way. My first thing to notice is she was very anxious, very emotional, very upset, which I completely understand.
Oh.
Tom?
Yes, yeah.
Do you know where the internox is in the back of that?
Entonox. Is it just that? Yeah.
Is that blue bag, yeah?
Yes, mate. Yeah, I'll have a look.
I'll tell you what, Tom, get the square little red bag, the drugs bag.
Drugs bag as well, yeah?
Yeah, mate. Yo.
How's this one for
That's
you?
it, mate.
Yeah,
perfect.
Cool. Entonox is a short-acting painkiller, more commonly known as gas and air.
Oh, and Beth? No, I haven't yet. She reckons she's hit the steering wheel because of the force, and she sits quite close because she's quite short. Whether or not she's just done a couple of rigs and that. I've had her feel with her collarbone, it all feels fine. So it's just, she needs an X-ray of her chest, really.
An ambulance has been called to take Bev to hospital, but until it gets here, she needs something for her pain. Dan injects paracetamol straight into her bloodstream.
How long have you been a carer?
3 months.
I can do your job.
Bev had just left one patient and was driving to another when the accident happened.
I couldn't believe it. I couldn't believe it. I just looked like it happened. I pulled my handbrake off. I took my seatbelt off. I panicked, and then I realised I couldn't move. My left side was in such agony.
How fast was you going, Beth?
I don't know. I couldn't be going fast. I've only just left Swanscombe to my last customer, to going on to a customer into Dartford. So no, I wouldn't have been doing that. I would have been doing under the speed limit. I would have been doing under 40.
As the ambulance crew arrive to help, Bev begins to recall the moments before the crash.
I just remember a bang, and I thought, what?
You know, it sounds like you might have blacked out, Beth. It does, all right? We'll get you an ambulance. We'll check the heart out completely, all right? I think she's blacked out the wheel. Now, she has a cardiac monitoring, 24-hour tape, so she's got some ongoing heart issues. Am I pushing, Beth? Am I pushing?
Yeah,
There we go, all right. Whether or not that's the cause for her to faint at the wheel, I won't know. Unfortunately, when she gets to the hospital and have some blood tests, they'll be able to work it out.
Now Bev is safely out of the car.
I don't think it will quite pass the MOT.
Tom's priority is to clear the road to let the backlog of traffic through. Once inside the ambulance, the team checks on Bev's heart.
Because we're creating, she's had a blackout at the wheel. The reasons for blackout are endless. It could be something, could be neurological, could be cardiac. The list is endless. So we're just doing an ECG because we know we've had a blackout. She's got cardiac history, just to rule out any serious heart problems.
Before she goes to hospital, Tom needs to eliminate drink driving as a cause.
Just going to get this fitted, all right?
We don't automatically assume they are drunk, or I don't have any indication to believe she is, but we still do it as a routine just to make sure.
Big deep breath. A little bit harder if you can. Has it done it? It's done it? Yeah.
Ah.
0.
I told you.
I know.
I don't know.
Grab hold of that.
What?
That's your souvenir.
That is your souvenir for tonight, as well as a smashed up car.
Is it right off?
Oh, yeah.
Oh, it ain't. It's my baby girl.
Is it?
Bev's car may be a wreck, but all her health checks are looking good so far.
To go to hospital, get a full workup, and they'll better hopefully work out what's happened to her. Less police cars here, that's a massive saving, a massive benefit to JU.
I don't need a bloody operation, do I?